The kinds of clinical work that I've done have been primarily with adults and more recently with adolescents. I certainly was trained as an adult psychiatrist, and I also, during my last year of residency training, did about half of my work in addictions. And so since I finished my training, I've usually worked in addictions in some setting or other, initially half-time in an addiction clinic, and then when I was in private practice, probably 60 to 70% of my patients had addiction issues in some way or other. Since I've been back at Cambridge Hospital for the last 7 years, I am on one of the teaching adult psychiatry teams. So we have medical students and residents come through, and our team spans general adult psychiatry and addiction. In addition, in the past, I've worked as an associate director for Physician Health Services here in Massachusetts, which is the state program for assisting doctors who have substance use issues, behavioral health issues. So I would, in that role, meet with physicians, assess them, occasionally refer them for further evaluation, and then oversee their monitoring if that's what was indicated. And in the last year or so, I've also been working in the adolescent substance abuse program at Children's Hospital. And in that capacity, I see kids anywhere from age 13 up to young adulthood who have substance use issues, either alcohol, marijuana, or other drugs. So most of the teaching I do is clinically based teaching at Cambridge Health Alliance. I am at Cambridge Health Alliance 20 hours a week. About half the time I'm there, I have either a student in the room with me, a Harvard medical student in the room with me seeing patients, or I have adult psychiatry residents in the room with me seeing patients where we're meeting patients and evaluating them together. So a lot of the teaching I do is clinically based with patients in the room, on the fly, often in very difficult circumstances. A lot of times we have to assess levels of dangerousness, whether we can let this person go home or whether we should send them to an emergency setting or something like that. In addition to that clinical teaching that I do, within the residency program at Cambridge Health Alliance, which is affiliated with Harvard Medical School, in the residency program, I teach the fourth-year residents medical ethics, particularly as it applies to psychiatry. And in addition, I teach professionalism. I do that in several venues around Cambridge Health Alliance, both to psychiatry residents, child psychiatry fellows, and occasionally to other attending physicians as well, about sort of professionalism and medical ethics. I actually do research and academic writing as well. Through Cambridge Health Alliance, I'm part of a research group based primarily out of the Department of Medicine. And within that research group over the last decade or so, I've authored and co-authored a number of papers and studies, some of which have gotten a decent amount of press attention. So for example, in 2007, colleagues at Cambridge and I surveyed students at 8 different medical schools to find out exactly how much training they had had on the duties of doctors during times of war. And we were doing this research at the very same time when stories were coming out about prisoner abuses at Abu Ghraib and Guantanamo, and doctors being complicit in some of those abuses. And what we found was that at these 8 different medical schools, 94% of students had had less than an hour of teaching about the duties of doctors during times of war. And when we offer them hypothetical questions, the Geneva Conventions would allow a physician to do the following. About a third of the time, the students were not able to answer correctly what the Geneva Conventions would mandate for a physician in active military service. That research was published and got international attention at the time. That same research group and I, we've also looked, for example, at the insurance industry's various investments. Found out, for example, that the insurance industry is heavily invested in tobacco. In one study, this, as you might imagine, was pretty surprising for a lot of people to hear this. And we used it in a way to show that the basic fact that the insurance industry cares a lot more about making money and turning a profit than about actually promoting health and well-being. And so in the same vein, we also did a study looking at the extent to which the insurance industry is invested in fast food, and not surprisingly found out that there are a lot of investments in fast food as well.